Right now, the Bronx is facing dueling crises, COVID-19 and measures against extreme police violence. Both crises have wreaked havoc, particularly on Black and Latino communities, and Planned Parenthood of Greater New York Action Fund is facing the challenges by head on. They're dealing with the barriers to healthcare and advocating for systematic changes within the police and healthcare systems. And the organization advocates for policies and legislations impacting the community. And joining us now to share further insight is the Director for Community Organizing at PPGNY Action Fund, Miss Leeann Ritz. And Leeann, good to have you.
Hey, thank you for having me. So excited to be here.
Great. I'm glad to have you. And as I said in the lead-in, when we talk about the times, obviously, for those in communities of color, it's a rough season right now. And trying to navigate, trying to navigate between COVID-19, trying to navigate between the civil unrest that's out there and the social unrest that's out there. But talk to us, because Planned Parenthood, of course, has definitely got some legislation and some policies that they're putting forward as well.
No, absolutely. As part of Planned Parenthood of Greater New York Action Fund, our top priorities as the advocacy arm of the organization, our top priorities right now are really just around making sure that we protect the reproductive rights and reproductive justice access to all the health care we provide, and continue to protect those rights, right? Mm-hmm. So how we do that is really just advocating on various levels of government, and also advocating in community spaces, and making sure that we are always a part of the conversation, because reproductive rights and reproductive justice is ultimately a human rights issue. So when we talk about human rights, there's no way that Planned Parenthood couldn't be part of that conversation. And so we are fighting for, all the marginalized communities, and that includes Black and Latinx communities, of course. That includes LGBTQ plus communities, and immigrant communities, and all the other communities that are hit very hard during this time, and always, really.
Yeah. And one of the things about being a community that's hit hard, when we talk about the community being hit hard, one of the areas where I know that we're particularly hit hard is right now, COVID-19. We're talking about these healthcare disparities. And I know that you guys have been very vocal about dealing with the healthcare disparities. So walk us through a little bit about what you want to see and what you really want to have addressed.
So when it comes to COVID-19 in particular, right, like the way in which our communities, and when I say our communities, I'm talking about communities of color, I'm talking about more specifically Black and Latinx communities, have been hit is crazy. And part of the reason why it's so crazy is because 70% of the deemed essential workers are from those communities. And because they do not have the time to quarantine because they're working as essential workers, ultimately those families have been hit the hardest. And then, of course, as Planned Parenthood being an organization, and I would like to say a staple in the community as a provider that gives care no matter what, which is our tagline, and we stay true and hold true to that tagline, regardless of insurance, immigration status, economic status, ability to pay, we are going to serve our community. And so we make sure that those are priorities for us. So anything plaguing those communities is plaguing us. That's our business, right? Because we cannot, when it comes to police brutality, when it comes to COVID-19, although people might not see that as a sexual and reproductive health issue, it is, because it is a burden to the communities we serve. So anything that is a burden to the communities we serve and is an obstacle for them accessing healthcare, and more specifically reproductive healthcare, we are going to be on the front lines fighting with them.
But and I know that, to the average person, commonly, when you say that doesn't really ring true, right? I mean, people think like, okay, well, we think Planned Parenthood, we're thinking about reproductive, the topic of abortion comes up. But then when you talk about immigrant issues, somebody's going to say Planned Parenthood, immigrant issues, these things simply just don't line up. But you say what?
Well, I say absolutely it does. And if you really think about it, when it comes to, so let's just use your example. You said
Right.
immigrant issues. So let's just talk about the recent SCOTUS decision that just happened, was just decided that that schools and employers actually have a say so on your reproductive justice, reproductive health access, based off of religion. And how could that be true? How could where you go to school and where you work, how could that impact, and why should they have any business in your reproductive health? But the point is that they're all connected, and that's the bigger picture. And when I started off talking to you, Daren, I talked about human rights. So that is really the umbrella under which we all operate. And when I say we all, I mean all nonprofits, all community serving organizations such as us. So we have to hold true to that. Every single issue that comes out of these communities are our issues. And I'm very clear about that.
And when we talk about being very clear about it, I want to be very clear about the budget, because of course we talk about the budget and the money coming to the community, and people are very clear. We talk about defunding police, reallocating resources, and for you, there is something called budget justice.
Yes. So, ultimately defunding the police is one of those themed policy movements out there, among many, that has gotten a lot of steam due to all of the uprisings that have been happening, and that's valid. But I think we as Planned Parenthood of Greater New York understand that it's important to break things down so that the community truly understands what it is that we're fighting for, and there's no gray lines, there's no gray area. And so we choose to call it budget justice, because that's exactly what it is. We need to look at the budget with a lens of equity, and in our minds, health equity, and use that lens to allocate funds in a way that is equitable, where it's needed, where it will actually invest in community. And so we believe in budget justice, because budget justice is the way forward. And that is how we are going to be calling it, as we see it, budget justice.
Yeah. Let me bring it a little bit closer to home. When we talk about COVID-19, obviously COVID-19 having a real effect right here in our borough. And when we talk about Bronxites who struggled during these times, how did you guys, how were you able to provide support services and at the same time navigate right here in our borough for people who were really dealing in that area?
Yeah, for sure. So in the Bronx community, we do have a center on 149th and Grand Concourse that, is well known, and most people know about our center. And even during COVID-19, we have been very, very, very steadfast in making sure that we remain open, we remain accessible, and we want to also uplift the fact that we need to be safe, right, during this period. So our tagline is care no matter what. And so we are doing that, and we have been doing that by offering telehealth services. And so this is a special type of service that folks can access via video conference or call, or over the computer using the internet. And then we also have the option of calling in and having over the phone consultations and visits with your providers, as well as in-person visits as well for those who need those visits, and it is determined by both the provider and by the patient that that's what is needed. And we also want to make sure that and I also want to uplift that telehealth services seems like a new wave. Most of our healthcare systems are practicing telehealth services at the time. Right now in particular, and we want to continue to offer that, but we also want to be clear that telehealth services aren't perfect, and there can still be barriers in telehealth services, especially with communities such as ours, particularly the Bronx community, and because there's barriers in accessing, having stable internet, for example. We just went through a struggle with our internet, but just being able to get that, also just competency around navigating apps and things like that. And we want to uphold and uplift that and make sure that we're tuning into those things. And of course, language barriers. and we want to be able to have those things available. So we are doing our part to, constantly take a look at our service to make sure that we are being able to offer the most high quality healthcare, no matter what, and being able to do it at an affordable and accessible rate and manner. So that's really what we're doing, and we're continuing to do that.
Yeah.
Yeah.
And when you talk about healthcare, obviously, let's talk about our borough again, the borough of the Bronx. And for those people who don't know, the Bronx has one of the worst health outcomes in all of the United States, one of the worst in the country. And so when we look at it, we see high rates of asthma, we see diabetes, we see a whole lot of other things where we have now and have for some time had this not number 62 campaign, because the Bronx is, of course, number 62 when it comes in health outcomes. But from your research and what are you seeing, what is contributing to some of these outcomes that we're seeing that have landed the Bronx at the bottom, particularly in the country when it comes to healthcare?
So I would break it down into two buckets. I would say the first bucket, of course, is systemic racism. Systemic racism is it's something that we've been talking about a lot in the press. So people have been hearing a lot about that. But in our minds as Planned Parenthood of Greater New York, we're very clear that systemic racism and economic inequities are contributing to the outcome, the adverse outcome of these health disparities. And you see these wide gaps in communities such as the Bronx, because access there's a barrier to access, and that's because of the systemic racism that exists within large systems such as our healthcare system, and also that contributes to implicit bias that is experienced by many people in the healthcare system and from their providers and from the system at large. And so when we talk about various health outcomes that have huge gaps, and the list is enormous, right? We could talk about more specifically like maternal mortality rates, and most people have brought this up, and I'm so happy that this is a point of discussion in a lot of spaces. But we just lost a young woman in Brooklyn on July 3rd, Shyasia Washington, who was getting a cesarean section to give birth to her beautiful baby, and she lost her life. And people are by right upset and have uprised because of that, very similar to Amber Rose Isaac here in the Bronx not too long ago as well, who was also 26, who lost her life. And so when we look at those numbers, when we look at those incidences and those cases and the lives that have been lost that are completely avoidable in a system where we don't want to talk about racism, we don't want to talk about the systemic racism, those are all things that contribute to the very deeply rooted mistrust and distrust within our community in the healthcare system. And those are the things that we need to address, as community-based organizations, as healthcare providers, and including Planned Parenthood. We're not excluded from that. So we are also having those very difficult conversations, but conversations that are frankly necessary and are overdue. And to make sure that we are repairing and doing the reckoning that we need to, repairing the harms that have been done historically, and reckoning with our past.
And when we talk about, a call to action and really dealing with this matter, how do you get the community involved? What is the call to action? What do we do? Where do we go from here?
Yeah, I love that question. There is so much people can do. And I think that people often ask, like, what is it that I can do? And it doesn't always have to look the same, right? It doesn't always have to be a protest or in the street. We do that as well, especially in the advocacy arm and in the Action Fund. We are always rallying, always protesting, always making sure we're standing in solidarity with our brothers and sisters in the struggle. But on top of that, I think that there are 4 tiers in which people can get involved. And, and when I say 4 tiers, I mean, there's the individual level. On the individual level, doing your research, educating yourself, having conversations like this with your neighbors, your friends, your family, right? and making sure that we do the work to unlearn and learn some of the things that we have all been, wrapped into, just by being in this society. And then also on an organizational level, like Planned Parenthood for Greater New York, as for an example, we have a lot of actions coming up. So for example, this week is the week of action that we launched, which is called Social Media for Social Movements, Week of Action, where we teamed up with the widow of Eric Gardner, Esau Gardner, and her team that has recently created and developed and made a film, a documentary on the trial that never happened for Eric Gardner. And so we are helping to screen that film. We have a whole week of action. Today, we are kicking off this week of action with a town hall discussion on civic engagement within the Black community and communities of color, and talking about how important it is to, fill out your census and to register to vote and to get mobilized and get organized and to be involved. And so, those are all things we can do. And of course, on a systemic level, just with it really comes down to dollars and cents and like, where do you invest your money? When we're talking about defunding the police and budget justice, we also should look at ourselves with the same equity lens and say, how are we spending our money? Are we supporting small businesses, local businesses, Black and brown businesses? Are we doing research behind these huge monopolizing, retailers out there? Are we doing all of that? And a lot of these things are coming to the surface, on social media and other places. People are starting to really understand that money talks. So there are several levels in which people can get involved, and we want people to do that. And you can also become a volunteer with Planned Parenthood of Greater New York by going to our website and click getting involved, and then and get involved with us and get the work done.
Yeah. Well, Leeann, I want to thank you. Got to leave it there, but some valuable information for our Bronxites and, of course, for residents across New York City. Leeann is our guest here, and she is the Director of Community Organizing, I should say, at Planned Parenthood of Greater New York. My problem with the P's, Planned Parenthood of Greater New York. Try saying that 4 times. Well,
right.
Thank you so much for joining us.
Thank you. Thank you for having me.